What's good, everybody? Sherman Webb, Middlebrooks, lifelong Buffalo resident and full-time black man, back at you with another episode of Igniting Hope Radio, sponsored by Highmark and the WIN Initiative here at the Buffalo Center for Health Equity on the Canisius College campus, where we are having conversations with folks doing the work in our community, lifting them up as they work addressing the social determinants of health in our community. Got a great episode today with two guests this time. I'm going to go ahead and let them introduce themselves. One of them I know very well, but I'm going to go ahead and let her introduce herself first to y'all. And then we're going to go ahead and get into this episode because they have an event coming up later this month that we want folks to come out, attend, and support, focusing on Black brain health. But without further ado, Jessica, I'm going to hand it over to you. Talk to us.
Hi, everyone. So my name is Jessica Amesquita. I'm a program manager for the Alzheimer's Association, and I represent the Buffalo territory and Niagara Falls territory.
Cool. And who do we have sitting here with you?
My name is Andrea Cook. I'm the Director of Community Engagement for the Alzheimer's Association. Cool. So I work closely with Jessica, overseeing Buffalo, a little bit of Niagara County, a little bit of Chautauqua County, and just trying to get the word out there about brain health.
Word. So brain health. I think I'm probably going to circle back to this a little bit, but when I hear brain health, like I think me and most folks might want to jump to like, oh, mental health. But is there any kind of let's get right to it. Is there any kind of designation or distinction between brain health and mental health? Are there similarities? Are there differences? Anything that overlaps?
Yeah, I think they're related. So when we're talking about brain health, one of the really exciting things that's happened in the past couple of years is that we have learned that there are tips and tricks you can use that support brain health and lower your risk for developing dementia or Alzheimer's disease when you get older. Cool. But mental health is a part of brain health as well. But what we're talking about when we talk about brain health is trying to prevent actual physical changes in the brain that lead to changes in thinking as people age. And we're hoping to prevent those.
Gotcha. Appreciate that designation. So, folks, if you're like me out there who heard brain health and instantly thought mental health, they have something to do with each other, but they aren't the same thing. Appreciate that designation. So, my real question is for y'all, for the folks who may not know who you are or what do you do. I think a large part of what we do is the why. So, why is the work that each of you do with the Alzheimer's Association important to you?
Yeah, so I can share a little bit more about my experience with brain health. So I actually am in recovery from a neurological condition. So similar to how we just spoke about brain health and mental health and the connection between it, I found myself in some challenging life experiences, right, where I started to learn more about brain health and mental health and what that meant and how I can better take care of my health. And I saw a position open at the Alzheimer's Association, and I instantly connected with the families, the caregivers, and the individuals going through Alzheimer's and dementia. So that's what brought me to working with Alzheimer's Association.
Cool. I appreciate that.
And for me, before I came to the Alzheimer's Association, I worked in nursing homes for a lot of years. So working with a lot of older adults, and many of them developed Alzheimer's disease or dementia. And, I think the thing that I loved most about my work is I had the opportunity to meet them then at that moment in their lives. I didn't have the baggage that family members have, right? Where I knew them to be one way and now things are really different and it's really painful, right?
Yeah.
I got to just meet them now and accept them for who they were. And they were hilarious and funny and still really insightful and just so delightful to be around. And I got close to so many people. I named my son after one of the residents that I used to work with, who was like my bestie. So, I just got to love these people for who they were. And that was such a blessing to be able to share that, and for their family members to know that they were in the care of someone who loved them for who they were now, right?
Yeah. Wow, that's super powerful. Thank you so much for sharing that. So I don't think I knew a whole lot about the Alzheimer's Association, maybe outside of, I think it's the walk, right?
Yeah.
That happens. And I know in certain communities, maybe really the community I'm from, we mispronounce that word like
Fair.
Alzheimer's, Alzheimer, like, but we know old timers. We know all of these terms, right? So I'm curious, outside of mispronouncing the name, what are some of the other misconceptions around Alzheimer's that folks in the community need to be aware of?
I would say just because you forget that you lose your keys or you misplace your keys or you misplace items, that's not the only warning sign, right? There's plenty other warning signs. Just because you're forgetting where you place everything does not mean you have Alzheimer's. It could be one of the warning signs, but first you should do a cognitive test with your doctor to make sure there's other warning signs before you go for that. And there's other warning signs too.
A lot of times people assume that as folks age, it's something that happens automatically, that everyone will develop.
So I call it old timers.
Right, exactly. Yeah. And it makes sense because it's most commonly seen in older folks. And your risk for developing it increases the older you get. So people who are 65 and over, 1 in 9 has Alzheimer's or dementia. When you get to 85 and over, it's 1 in 3. So the older you get, your risk continues to increase, but it's not inevitable. It's not something that's going to happen to everybody. And I think that misconception is an important one to kind of get rid of, to debunk, because I think a lot of times people will think, well, this is just something that happens. There's nothing I can do about it, and they won't seek any help. Right. They'll just think, oh, this is something that happened to my grandma and her mom before her and her mom before her. We just deal with it, not knowing that now there are medications available that can help keep the person in the early stage where the symptoms are just mild. They can keep the person there longer, but we need to detect it early in order for those medications to be effective. So we really want to get the word out that if you're noticing a change in yourself or a loved one, it's really important to get to a doctor right away and get evaluated, get a screening. You can start with your primary care physician. They may refer you to a neurologist for more evaluation, but it's really important to kind of get on top of that as soon as you can, because then you have more options available. And the earlier you can start planning for what might be to come, typically the better quality of life that person's going to have as they go along.
Yeah, it's like, it's not exactly like, but it's making me think of that old adage, ounce of prevention is worth a pound of cure.
Absolutely.
So when you're talking about the brain health stuff and being more proactive early on in life, I think that that's sort of what you're speaking to.
Absolutely.
And I just want to double back to the brain health thing. Do you guys have any, because, man, I'm about 35, unfortunately, in my community. I'm middle-aged.
Yeah.
So what are some of the things that maybe somebody like I can do in my 30s to maybe be preventative, like that ounce of prevention?
Absolutely.
So we have something called the 10 healthy habits, right? So there's 10 healthy habits that you can do to maintain a healthy brain. One of those could be, exercising more, doing cognitive intellectual activities like puzzles.
Okay. Who likes dominoes?
There's other things like exercising. Trying to think of some more.
Getting good sleep. Which is easier said than done sometimes, especially if you've got a little one at home, right?
Yeah. So that means all the aunties going on them church casino trips.
They're doing great.
They doing good. They is maintaining the seat.
Yeah.
Let me stop.
Well, and social activity
social
too. So
okay,
you're checking off a lot of boxes there. Yeah.
Okay, cool. I just want to add a little bit of levity because I know this could be a tough conversation.
It sure can.
A tough topic to talk about. Okay, and also I'm trying to be more mindful of what I can do.
Right.
So I appreciate that.
Yeah. And to add to that, healthy eating. So lifestyle. So for our young people that like to eat out a lot,
or old people.
unfortunately too, the way we cook. So the types of oils that we use, the lack of nutritional meals that we eat. So we have to consider, like, are we eating enough fruits, vegetables, and supplements that help our brain? So all of those things come at play when you're thinking about healthy habits. Yeah.
Good point. Good point. And I think, what is it, like the omega-3s in the fish oils and stuff like that? I'll be watching a lot of commercials, especially when I used to be with my grandparents.
Right.
They be having them commercials for everything. All the older folks getting all them supplements. Okay, cool.
If I can do an anti-commercial real quick.
Please do.
Speaking of the older folks and their commercials, my son loves Wheel of Fortune. So he's, probably significantly younger than a lot of the folks watching. They always advertise that that supplement called Prevagen. It's no good.
Okay,
it's good in theory. So the company that developed it, they tried to go through clinical trials to develop an actual medication with it, but it failed the clinical trials. So what they did instead was to start selling it as a supplement, because that way you don't have to go through FDA approval. You don't have to prove anything to anybody. And they can just say, well, it does seem to work for some people. It seems to help some people. So here. And then they put a ton of money behind marketing it. So people ask us about Prevagen all the time. And unfortunately, those kind of supplements, the Nariva,
just a money grab. And take advantage of folks who are trying to do what they can with limited knowledge and information. All right. And that is why we have this platform. That is what we're here for, to disseminate the proper and correct information. So outside of the 10 healthy habits and those tips, outside of dispelling myths and those kinds of things like that with the Prevagen and whatnot, and organizing events like the Black Brain Health Conference that we're going to talk about in just a second, what are some of the other things that your organization is doing to help support families here in Western New York? And also, how can people get involved to support? And also, we a family-run organization here at the Buffalo Center for Health Equity. So if you hear my nephew in the background, that's him on his iPad, because these mics are good. Shout out to them for the investment. But that's my nephew in the background, y'all. He on his iPad doing this thing. We a family operation. So how can folks help you, and what are some of the other things that you guys are doing to support families here in Western New York?
So we do 2 support groups in the east side of Buffalo. One of them is held once a month on Thursdays at the Frankie Merriweather Library in the evening. So people still have time to get to it.
Jefferson and Utica, right?
Yep. 5:30 to 7:30. And we have another support group at the Delavan Grider Community Center once a month on Fridays. And that one is earlier in the day.
Cool. Good. I love to hear that. We love support groups. I offer a men's mental health support group every second Monday of the month here. And I think having a space is such something that I think is underestimated, the impact that it can have on people when they know there's some place they can go where people already know and understand what they're going through. They ain't got to create a whole bunch of context, and they can be around folks with similar experiences, and they can vent things that may be frustrating them so they don't go home and project it. And then they can also learn different skills and tools to be able to more effectively manage wherever they're going through, whether you're a caregiver to somebody who is living with Alzheimer's or dementia, or you're living with somebody who's dealing with mental health and wellness, or dealing with being involved with the justice system. I'm a big advocate of people holding and maintaining groups and spaces for people who are having a specific life experience to come together. So thank y'all for that.
Yeah. Super powerful. And so those are the 2 groups that we offer in person in the city of Buffalo. We also have groups in the suburbs as well. And we also have virtual groups, which can be really helpful, especially if someone is a caregiver for someone and they're not able to leave their loved one at home safely anymore. So we have a men's group, which, as you well know, sometimes it's really helpful for men to be able to talk to other men. It feels more comfortable. You speak kind of the same language. We have a daughters group, wives group. We have groups for people who have rarer types of dementia other than Alzheimer's, which is Alzheimer's, actually, let me take a minute here. So
break it down.
All right. So dementia is this umbrella term, right?
Okay.
And under the umbrella of dementia, there are over 100 different diseases that cause these brain changes that we're talking about when we say the word dementia. So the word dementia is kind of like the word cancer. Under the umbrella of cancer, there's all these different diseases.
Oh,
Same thing goes
okay.
for dementia. Same thing goes for dementia. But the most common dementia-causing illness is Alzheimer's disease. So probably 60 to 70% of people who have dementia symptoms, meaning brain changes, have it because they have Alzheimer's.
See, I thought it was the opposite. So
A lot of people do.
Alzheimer's was the umbrella term,
right? Yep.
And dementia fell under that.
Yep. A lot of people think that.
Okay.
Especially because doctors, sometimes they'll say, oh, it seems like you have dementia. And then as it goes along, they'll say, oh, it looks like you have Alzheimer's. Because now that the symptoms have progressed, they're like, oh, it's pretty clear that this is the specific disease you have.
Okay.
Yeah, when they say dementia, they're saying, like, you got something, one of these diseases. We're maybe not entirely sure which one yet. Okay. So there's other types of dementia, like frontotemporal dementia, that has a different set of symptoms. And actually, the actor Bruce Willis just came forward. Okay. He has that. So for him, he lost his language.
Yeah, and his family wasn't letting him come out and do public appearances.
Yeah.
I remember seeing that. I like to follow up on celebrities.
Yeah.
His family, that's why his family wasn't letting him do public appearances. Okay.
And Wendy Williams' family has come forward and said that she has frontotemporal dementia as well. So I think there's some complicating factors with that one as well.
And I'm sorry.
Yep. So there's, it can look different, right? These folks, maybe the first thing that you see, it's not memory loss, right? It might be changes in their behavior, changes in their ability to speak. There's another type of dementia that we have a support group for. It's called Lewy body dementia. Folks who have that, and actually they say the actor Robin Williams, he was developing that and decided to take his own life because he was terrified, which is heartbreaking to someone who works in this field, that was his reaction. But folks who have Lewy body dementia, they oftentimes have symptoms of Parkinson's disease. They may have movement issues. They oftentimes have visual hallucinations where they see people and things that aren't there. So there's a lot of different symptoms that can kind of come into play, and it looks different for each person.
So a close friend of mine recently, like around Thanksgiving, he lost his grandmother. She lost her battle with dementia. And it was very challenging. I know he moved home to be more of a support for his grandmother and his father. And I just remember being the best support I could to him. And one of the times he reached out to me, he was a little overwhelmed, a little frustrated, because he just was like, she keep talking to people that ain't here.
Yeah.
It's like, yo, mom, it's like, she keep talking about her mom. He's like, your mom been dead since 1940 something.
Right.
I don't get it. But he was like, there's only so much you could do. My man's ain't equipped to this. He's a security guard. He live his life. He's not really equipped for this. He just know he's supposed to be home. So he like, bro, I don't know what's going on. It's frustrating me.
Yeah.
And, being the best friend I could be, giving him a space where you can share that before you go home and project that.
Yep, absolutely.
And so, but I was just thinking in my mind, I'm like, but I thought Alzheimer's and dementia, man, you forget stuff. So how you remembering people that ain't? But now that I have more information after this conversation, that's a clearer picture to me.
Yeah. And with Alzheimer's, one of the interesting things that happened I used to notice this a lot when I worked in nursing homes, was that people who have Alzheimer's disease, the interesting thing is it's the recent memories that get lost first. They have a hard time holding on to new information, but our long-term memories live in a different part of the brain. So a lot of times,
Amy G.
So they will think that they are kind of a younger version of themselves. They'll be walking around looking for mom and dad, even though mom and dad have been passed for 30 years, right? Because they're in that point of their lives, that's the part of their memory that's the sharpest. So that's where they think they are in their own timeline. They'll say, I want to go home. And the home they're talking about is their childhood home. I think families, a lot of times, the thing that really breaks people's heart is she doesn't recognize me anymore. A lot of times what that is, it's not that they've forgotten who you are. They're expecting a younger version of you to walk in the door. So when they say your daughter's coming to visit, they're not picturing daughter, they're picturing daughter, right? So this grown woman walks in and they're like, who's this? That it doesn't click. So it's not that you're gone from their hearts, right? It's not that they've forgotten who you are. They just don't expect you to be an adult, right? So sometimes you get talking to them and it's like, yeah, okay, I know you, right? Or they think like, you must be my sister because there's a family resemblance, not realizing it's a daughter. So you just got to kind of show up and show them love and not argue with them. Just tell them it's okay. I'm here with you. We're good. I'm just here to help. And then, you can kind of get along together, right?
You made that make a lot of sense.
Yeah.
And to add to some of the things, the support groups that we were sharing is knowing what to say and how to say it and when to say it, right? So we also do a lot of programming, free programming all throughout the counties in Western New York to provide that additional support that not only caregivers need, but providers, staff that work at nursing facilities, just the average person that just wants to learn more about Alzheimer's and dementia. We have programs around managing money and caregiving, a financing guide for caregivers. We have programs like caregiving through the holidays. How do you manage, when you have families coming over, family coming out of town, maybe they want to put their 2 cents into how you should live with your loved one, right? That could be tough for people coming at your house, like, well, you should do this and you should say this.
You ain't the one here taking care of mine. I had to help. Yeah. As a friend, I've had to hear those conversations.
Yeah. So we're not here to really intervene, but with Alzheimer's Association, we're really here to provide that additional education and support so that individuals know how to better communicate with their loved ones and, so that we can all support each other.
It definitely helps to have a script and have words because you don't want your first time having that conversation with your friend or loved one to be the first time you had that conversation with somebody. You might want to practice that conversation in a safe space because we are human beings and we are very susceptible to becoming defensive and aggressive. And then we lose sight of the goal of like being supportive and helping this family member or getting the support we need. Now it's about being right and getting our point across and feeling better in that moment of being better overall as a family. So it's very important that folks reach out and utilize the support and resources that are being provided to you, especially like Jessica said, it's free.
Yep.
It's my favorite number. It's my favorite number. My favorite number. So we talked a lot about just what you guys do in general, and I really appreciate the knowledge and information, not only for our audience, but for myself as a member of this community. So you have something that's coming up specifically for the Black and Brown community. So I want to learn and know a little bit more about why it's important to talk about brain health in Black and Brown communities, and what are some of the disparities that you may see when it comes to diagnosis or care and access to resources?
So I'm actually a newbie to the Alzheimer's Association, and I actually gave some recognition to Andrea because she started this conference, and this is the 6th year that they're doing the conference. I'll let her speak a little bit more of how she got started with the conference, and maybe I can share some more things that are happening this year.
Actually, I can't take I took over 2 years in, so we're just kind of passing the torch. So shout out to Lauren Ashburn if you're watching. She got it going. Kick things off. So this conference, we started it back during COVID. It was a virtual conference. And then starting a couple years later, we moved.
Wow, it is 2026 and COVID was 6 years. I'm sorry, I just had a moment. I just had a moment.
Right? I know.
I need to work on my brain health because I just had.
It's like sometimes feels like it was forever ago, and then sometimes feels like it just happened. Right? So we've held the event for a couple of years now as a hybrid event. We want people, and we want this to be as accessible as possible. So if folks want to come out and join us in person, we're really happy to have them. But if folks can't make that commitment, or, it's February in Buffalo, so you just never know, right? We have it via Zoom as well. And the cool thing is, since it's open through Zoom, we get folks from all over the place. We had someone join from Ghana last year. So it was just really cool to like bring people together from all over the place. And frankly, I think this is a topic that is a little more taboo in communities of color than I think it is in white communities, right?
As a member of the communities of color, yes.
Absolutely. So, we want folks to know that Alzheimer's and dementia, these are brain diseases. It's not that you've done something wrong. We're learning more about prevention now, and that's great. But we didn't know that a couple years ago. So we're just living our lives, doing the best we can. And unfortunately, it can happen to anyone. A lot of times there can be like a family history, but not always. Sometimes it just happens out of the blue. And we want folks to know that it's a brain disease. It's nothing that we should be embarrassed of. It's something that we should be ashamed of. And we want folks to learn more about it and know that there's support out there. So we've had kind of different themes each year as it's come along. And we're really excited about the brain health theme. And I'm super excited about the stuff that Jessica's bringing in this year. It's going to be a really great event.
Thank you. I appreciate it.
Talk to us.
So I cannot take all the credit. We have
I love how y'all sharing credit.
We have a powerful committee. We have a powerful planning committee with Buffalo Black Nurses Inc. Being involved in the committee. Dr. Melissa Archer, shout out.
Yeah, shout out Dr. Archer.
We have the Veterans Hospital also in the planning committee. The Buffalo Center for Health Equity. Hey.
Right. BCAG, we doing things.
Shout out to Gia. So we basically came up with this theme around heart health and brain health.
Okay.
So for y'all that don't know, February is Heart Health Month. Yeah. And of course, recognizing and Black History Month and the importance of having keynote speakers that represent the community. So we will have a group of 3 powerful keynote speakers. Shout out to Kelly Wooford from the Office of Health Equity.
Barrett from Kaleida.
Okay, cool.
And Minnie James from the Erie County Office of Social Services.
So cool. They have a really cool project, and they'll be there at the conference. So if you cannot make it in person, we definitely would like for you to register it and watch it via Zoom.
So if you want to know where the location is at wherever you are. If you in Buffalo, it's here, and if you somewhere else, it's there. Do you got a phone? We all got phones. Even if you got the consumer cellular joint, because I be seeing the commercials. All the folks 55 and older got the consumer cellular wireless. Even if you got consumer cellular wireless, you can log on to the Zoom and get what you need in this conference.
But specifically, it will be at BFNC.
That's right.
Maine and Leroy. So
it's gonna be there.
Yeah.
It's important that we keep the conference in the east side of Buffalo. Folks don't like traveling too much. Building. It's beautiful. Nice free parking.
Okay.
Free food. We'll also have a resource fair.
Okay, cool.
We'll be doing a cooking demonstration by Rachel with Real Life Dietetics. Cool. And we'll also be doing a fun activity involving your brain. And last but not least, we'll be doing Taekwondo yoga.
I like the sound of that.
Right?
I like the sound.
Right?
So getting your body moving and your brain and your brain stimulated and your brain active and you coming together and you building community.
Yeah.
Which I think is super important too, because I've never directly had a family member or loved one like directly experiencing dementia in that way. But I've been a part of other communities. I have friends and loved ones who are caretakers, and I know no matter what you're going through, it's always easier when you ain't alone. It's always easier when you have a community of people who have similar shared experiences. So if you're an individual who's a caregiver in that situation and you're looking for a community, maybe your friends and the coworkers don't understand what you're going through. Maybe your spouse don't understand what you're going through. Maybe other people in your family don't get or understand what you're going through, and you're looking to find your tribe of people who you can show up and build that community with. What day is it again?
February 28th.
February 28th. That's very easy to remember. Last day of the month. I'll be there. I'll be there taking pictures and doing some videos and stuff like that on behalf of the Buffalo Center for Health Equity. Is there anything else that you guys want to share, talk about, lift up regarding dementia, Alzheimer's, racial disparities, the Buffalo community specifically? Anything else that you want to shed light on?
Yeah, I would like to share that, as Andrea mentioned, that this disease, it's not something that anyone should be ashamed of. I know that within communities of color, whether you're Black, Brown, Latino, Latina, just because we don't talk about something doesn't mean that today's not a good day to start that conversation, right? So today is a good day to reach out to a loved one that maybe you haven't reached out to and just check in. Because a part of having a neurological condition is that you might forget to socialize, or you may be ashamed because of you're going through certain things that you don't want to express that to people. But, checking in on your loved one could definitely help save a life and connect them to the support that they need. And the other thing that I want to mention and highlight is that with it being Black History Month, unfortunately, we have had this going downhill. We were up, now we're going down. I'm sorry, y'all, but to be real, systems of care haven't always benefited Black and Brown communities, right?
Absolutely.
And we're just starting to get to a change in the healthcare system where we're highlighting those changes and we're saying, you know what, enough is enough. We deserve better. We need better. And we should fund, hospitals, clinics in Brown and Black communities because they need the care and they need the support and they need the treatment and the prevention. So that's really important for me to highlight that because our communities know that, like our generation, I feel like our younger generation knows that the changes are coming. But I feel like the older generation might still feel like, this is a battle that we ain't gonna win, right? But I want to speak to the younger generation and let them know that we need you guys to come out to vote and to talk to your legislators, talk to your senators, and lift up the need for additional funding, especially when it comes to our brain health, and our heart health. See what I did there? Brain health, heart health.
Need both of them.
They're intertwined.
You can't do nothing without them too.
It's true.
Exactly.
Yeah. You get Stan Martin and they do the lungs and then now we done got the whole body. All wellness. Social determinants health. No, I love that. Your earlier point that you made too, and I want to underscore that and lift that up as well. Charlemagne the God says that we're the first generation that gets to heal. And I love that. And I live by that. Yes. We're the first generation that gets to heal. And so that is probably why our generation sort of has a little more optimism. And I understand, I'm empathetic to the generations that came before and the realities of their experience and maybe why it wouldn't have been practical for to have a little bit of optimism. I can understand that and empathize. However, we're the adults now, and you young people will be the adults. So to reiterate what Jessica said, we need y'all to be the leaders to step up. If your family doesn't do that thing, you do it. You're the leader in the family now. Whether you younger, you do it. They do it now because you do it. Just specifically, I remember my family didn't say I love you a lot. We said it, but not a lot. And I just noticed that. So I just started saying it more just because like we don't say it enough. So I'm gonna do it. Yep. So like it could be simple things like that. And that's how you become a leader in your family and community. It ain't just about who got the title or the big office or all the money and the power. It's about the influence and showing up and using your authenticity in order to influence in a positive way. Again, how can people support what y'all doing? How can they get involved, volunteer, and how can they get involved, volunteer, and support so that way there's more people out at that walk? Which you guys did a beautiful job. I enjoyed myself out at that walk. Y'all picked a beautiful location. So how can we get more people to become more involved and support the work that you're doing? Because I think it's twofold. The people who are experiencing dementia need the support, but the caretakers and caregivers need support too. Absolutely. So what do you guys need? How can we help?
You said it. Volunteer.
Okay.
We need additional volunteers to continue to do the work that we've been doing. So whether that's community education and providing education in the community or virtually, or volunteering to help out with some of our support groups and our community events. So like walk or our caregiver brunches. We need volunteers that are willing to commit a year to being a volunteer. That's really all that it takes. It's just a 1 year commitment. Fill up some paperwork, and then that's it. You're a volunteer.
And they'll be working with you, right?
They'll be working with myself. Yes.
Okay. Cool. So that way, it ain't just like we got somebody sitting here and we gonna have you. No, this is look at this. Look at this smiley friendly face. Look at this. Don't you want to work with them? Anything that you have for the people, how they can support, help?
Yeah. Well, so to Jessica's point, with volunteer opportunities, we are always looking for people to be volunteer advocates. So to go with us, to go and speak to lawmakers, to write letters to the editor, to retweet things on social media, right? To get the word out there and keep it in the forefront of lawmakers' minds. We like to say that Alzheimer's, our color at the Alzheimer's Association is purple.
Yeah,
we like to say it's not a red issue, it's not a blue issue, it's purple.
See, this is what happens when you focus on your brain health. You can put together little witty things like that. That's I love that. I love that. That is.
And the nice thing is that generally speaking, lawmakers, if we get loud enough and we make them aware, no one's in favor of Alzheimer's disease, right? So if we get rowdy enough and we draw their attention to it, they generally support us, right? So having more voices amplifying that message is really important. Yeah. So and it can be being out at health fairs for us, helping us with tabling events. We just want to make sure that people are aware of the cause, know that this is not something that goes away if you pretend it's not happening.
That's the thing. I swear. Right? Ooh, Lord.
Right?
Ooh, Lord. A lot of folks be trying to do that.
Yeah. And I strongly encourage not drinking it away, not smoking it away.
Amen.
And I just have to highlight that because in honor of Black History Month and in honor of our health and being the generation that heals, sometimes substances can get in the way of our healing process. And it does impact our brain health. So definitely encourage individuals to check us out on our website or call our 1-800 number for additional support. So our helpline is actually available 24 hours of the day. So even if you have a loved one that maybe they left the home at 1, 2, 3 o'clock in the morning, and
what's that helpline?
They
we got the right there.
There we go. Yeah.
The helpline is 800-800-272-3900. And it's important that you have a number to call. Save that number.
Tell me it again one more time.
0.
Any time of the day.
Any time of the day.
Confidential.
Yep. We'll support you and your family the best that we could.
We can answer questions. No question is too big or too small. There's no such thing as a dumb question because it's not like we missed the day in high school where they went over Alzheimer's disease, right? You don't know this until you're in it, right?
The only stupid question is the one you don't ask.
That's exactly right, right? Yes. So, we're available to give answers whenever folks need us. If people find themselves at 1 o'clock in the morning, exhausted and overwhelmed and feeling like, I don't know how I'm going to get out of bed tomorrow morning, you give us a call and we'll talk you through it. We've got master's level social workers you can talk to in the middle of the night who can provide that kind of mental health counseling to you in the middle of the night if you need it. So
you hear that, nephew?
He hears it. He's here for it. Yeah. So, we just want folks to know that they're never alone, right? I think the support groups and the education, all of that, it's really powerful. And finding your tribe, that's super important and super powerful. But sometimes the phone gets real heavy, right? Sometimes you don't want to burden somebody. Sometimes, that's the thing. at 3:00 in the morning, call people who are, it's literally their job to help you shoulder that burden, right? We're here for that. So, if you just need tips, you just need to vent, we're always available. It's free and confidential.
I appreciate that. Glad that we were able to talk about the tip line, the support groups that you're doing in person at the Meriwether Library, the Delavan Writer Center, the Zoom calls that you guys have going on. There's groups out in the suburbs that you mentioned as well. If you want to volunteer, you're gonna volunteer and work with this wonderful lady right here, who I happen to know very well and trust endearingly with my life. And you also have the Black Brain Health Conference that is coming up February 28th at the Buffalo Federation Neighborhood Centers, the BFNC, that is on Main and Leroy. And there will be free parking and there will be free food. And what time is we going to be there hanging out?
Noon at 12:00.
Noon. So noon. And
show up early, y'all. Don't show up late.
So it starts at 11 o'clock. I can say this. I'm a full-time Black man. So because this is the Black Brain Health, we're going to tell everybody it's at 11, then people going to get there at 12:30.
And for those that know you are like, Jessica always late. You know what? I'm going to be early. I'm going to be there at 10 o'clock. So
if you know Sherman too, you know Sherman, you got to tell me an hour early. So yes. So it's at 11 o'clock. No, I'm just playing. It's at noon, but if you a person, and if you a late person, you're the expert in your own life. So noon, February 28th, BFNC, Main and Leroy. Come ready to eat. Come ready to work and talk. Come ready to rejoice. Come ready to build community. Come ready to learn. Come ready to share. And also come ready to get your picture taken, because I'm going to be there taking pictures and videos. So give me an interview and we can talk about what Black Brain Health really means to you and in your life. Is there anything else that you would like to share? Your website, social medias, things like that, how they can get involved one last time?
You can check us out at ALZ for additional information, whether it's Buffalo or any other county or nationwide. If you just need support with dealing with Alzheimer's or dementia, alz.org will be able to support you. We'll find some kind of support for you.
We're on Facebook, Instagram, LinkedIn, all of it.
Yeah. Yep. Look for the purple. Because it ain't a red issue or a blue issue. It's a purple issue that might end up affecting you. For the Center for Health Equity, my name is Sherman Webb Middlebrooks, lifelong Buffalo resident and full-time Black man. This has been another episode of Igniting Hope Radio, brought to you by the Buffalo Center for Health Equity, sponsored by Highmark. And in the words of my hero, the late, great, honorable Jerry Springer, out there, take care of yourself and each other. Peace. Episode. That was
great.
That was
sweet.
We good, nephew?
Wrapping up with Jerry. I like that. Nice touch.
Nice touch. That's my hero. I end that no matter what I do.
There you go. I love that.